And welcome back to day 3 from the Rural GP Network Conference, where we're doing our final broadcast. And we've got a fairly exciting half an hour planned. We're going to start with my first lovely guest here, Simone, who's going to tell us about the Pat Farry Trust, after which we'll see a graduate of the Pat Farry Trust, the recipient of the grants. And finally, we're going to have Martin London and myself, and we're going to just wrap up the conference as we saw it and just highlight all the bits which you might have missed. So I'm going to start with Simone Flight from the Pat Farry Trust. Simone, look, tell me all about yourself. And now you're telling me you're Pat Farry's niece.
I am.
We cannot use the word rural health and not say Pat Farry in it. They're sort of almost synonyms, aren't they? So would you like to tell us about yourself and the Pat Farry Trust?
Okay, so as you mentioned, I'm Pat Farry's niece. I come from a background of marketing and communications background, but first and foremost I come from a background of spending many years in the household of a rural GP, and from that perspective seeing the life of a rural GP, in particular seeing someone like Pat Farry, who first and foremost that's what he was. He was a people person, he was a rural general practitioner dedicated to his community. So I won't say stars have aligned as such, but when Pat passed away and the trust was set up, it was very humbling. I know for anyone involved, and especially the family, the monies that came in with the express wish of continuing the work that Pat had been doing, both as a general practitioner, as a mentor, as a teacher, as someone who inspired other people. So I, in the last year, moved back to Queenstown, which I call home. I've had many years away, 15 years away, and probably from the first year trying to get back to Queenstown.
Welcome home.
Thank you. So I came back, and it was really this alignment of we need some help from the marketing perspective, more that it's time to take the trust from the setting up stage to really moving on and going to the next stage. So I was brought in to help with that. I've got this very euphemistic title of project manager, which is a really good catch-all title for let's just throw anything at you, see if you can catch it. Here's your project.
There's many project managers identifying that. Good on you.
Yeah, so I mean, and it was again, humbling yet again to come into the trust and to see what had already been started and what had already been happening. And then to look and assess really where the trust's strengths were, where the opportunities were, and that's been my task in the last 6 months, to actually look at that and help the trust move into the future.
Awesome.
There was Sue spoke beautifully and from the heart last night, Sue Farry, with regards to where we're focusing and sort of really clarifying what the trust is here to do.
So for those of us who weren't there last night, can you tell us about the trust? What exactly does it do? And
the trust was established first and foremost to continue Pat's work, to continue his legacy. So I mean, in essence, it is to ensure the sustainability of quality health service to rural communities of New Zealand.
You've got a promotional brochure there.
I'll do my Lana Cocroft moment.
Perfectly done. So that's the Pat Farry Trust. I don't know whether we got a good look at that, and it's got an interesting logo at the top there. Now, can you tell us about the logo?
Shall I tell you the PG version or the?
No, the R18 version.
We'll go for the R18 version. Okay, so two versions. It's the symbol of Matagauri, so it's a logo version of Matagauri, which is a very spiky native plant.
That was PG.
That's the PG version. The other version is that there's just a little sort of knob in the middle of that, a little spiky knob, or as Susie will joke, that people often said that Pat was like the little prick, the little prick that got in there and just made his message heard. So that's the R-rated version, so whether or not that's to be used. But we actually, that goes down quite well in rural areas, because it really is. I mean, this trust is not about ivory tower. This is actually within the communities, within the people that Pat served, as well as the students, in fact, that Pat mentored and were so dear to him in his work.
So needless to say, we had a fantastic fundraising event 12 months ago in Queenstown, and now Sue did tell us how much was raised at that one?
$40,000.
Which is wonderful.
Absolutely amazing.
Where is that money going?
That money is going into scholarships. So first and foremost, the Trust is the work that it is doing right now and the phase it's in are looking at scholarships for medical students, and a scholarship that's awarded every second year to a health professional, a rural health professional in their first 10 years since graduating. So taking back to the students, what we're looking for are the students who will be the next thinkers, the next innovators, the mentors of the future. So in selecting amongst the candidates who apply, and what they're applying for is for dollar support for their 6th year elective. So what that is going offshore in particular, to have that experience in a rural environment outside of New Zealand, being able to bring that knowledge and experience and what we'll hear from Kerry, that personal growth back to New Zealand. So that is the first of the scholarships. The second is the biennial scholarship, which will help a health professional in their first 10 years to do the same thing, but probably a bit further. It may be a 1-year sabbatical, a 6-month sabbatical that we're able to support financially. And the first of these will be awarded this year. And that again relates back to Pat's own experience. It was his travel and his ability to see rural health practice overseas and to be able to study and to be able to network, that really for him he felt that that was a huge part of becoming the GP that he was.
So for anybody watching tonight who is going to be winning lotto and they're sat on this 10 million, they don't know what to do with the money, how do they give half of that to you?
Well, they just come straight through to our website and all of our contacts are there. That is the fastest way in these times to come through and contact us. We have an email address, but go straight through to the website, patfarrytrust.co.nz. We will make it as easy as possible for you to transfer as many monies as possible to us, but be absolutely be sure that those monies will be in these first years, be working with students, be working with young rural healthcare professionals. Then in the future what we're looking to do, and this was really another thing that Pat was very, very keen on, is how we can take the technological advances that we have in terms of communications and how we can use that to bring quality education, quality services out to the rural areas. Now obviously the mobile surgical bus is you know, the huge bells and whistles example of that, taking the healthcare out to the regions. So what the Pat Farry Trust are looking for in their, not immediately, but in the longer term, is a project or an initiative that we can either get in behind or that we can support that will harness technology to be able to assist the quality of rural healthcare education, either for students. It might be, in fact, helping educate communities. It may be something that is tying those doctors in rural Waikato to an equivalent practice, an equivalent base hospital, perhaps in rural Australia, rural US.
Awesome. Now we've only got 30 seconds left of your time, and I feel a bit like Dr. Phil here because off stage at the moment, but she won't be able to hear us. So you've got 30 seconds. Why did you select our next guest, Kerry? What was special about her? And you've got 30 seconds.
An absolute spark, and I think that's it. We are looking for that spark that tells us that this is someone who, in the future, dedicating themselves, they will dedicate themselves to rural medicine, but they have that spark. They get it. Pat would have sat down and yarned with them for hours. It's a hard litmus test and it's like an X factor.
That is wonderful. Well, that introduces better than I could, I think, really. No.